Hello, Muscle Whisperers. This is Elizabeth from Coaching to Wellness. Today, I'm working on the upper leg while the client is in supine, and we're focusing on some of the most overworked and often neglected muscles, the adductors, quads, and hip flexors. This is the follow-up to a previous video where I worked on the lower leg compartment. Now we're moving higher. I start with long, flowing effleurage strokes just to warm the tissue, increase circulation, and introduce a therapeutic touch. This also gives me a moment to feel what's going on, where the tension is hiding, what's tight, and what's tender. With this client, right away I noticed the muscles were tight and ropey, the kind of tight that doesn't just go away with stretching. I begin my deeper work on the adductors, moving slowly and intentionally with my strokes. This area is often ignored in general massage, but it plays a big role in stabilizing the hips, supporting the pelvic alignment, and keeping the legs from overcompensating. I use muscle stripping, starting from origin at the pelvis and working down toward the knee. You'll notice I'm not rushing because when abductors are tight, they can pull the hip inward and even restrict knee mobility. From there, I shift to the quads, especially focusing on rectus femoris, which crosses both the hip and the knee. Tight quads can cause anterior pelvic tilt, low back pain, and even limit squat depth or running power. I continue with muscle stripping, then layer in some cross fiber friction to separate the muscle fibers, breaking up adhesion that might be causing that stuck, crunchy feeling that some of your clients may describe. You can also use the palm of your hands or knuckles for deeper pressure. This can allow you to glide with control and without overwhelming the tissue. The hip flexors. This is a huge one for athletes, active professionals, and honestly, anyone who sits for long periods. When tight, these muscles can pull the spine forward, reduce stride length, and compress the lower back. I adjust the draping, gently assess the iliacus and psoas region, and use slow, intentional pressure to reach the deeper layers. This isn't a race, it's about listening to the tissue and involving it in our massage. At this point in the session, you can visibly see how the tissue is changing. What started off as tight and ropey is now soft, responsive, and more mobile. Remember, manual therapy isn't just about rubbing out knots. It's about understanding how muscles work together, how adhesion form, and how to bring movement and freedom back to the body. In this session, we supported the adductors, quads, and hip flexors, all while the client remained in a relaxed supine position. This is perfect for pre-competition prep, recovery days, or just restoring alignment. Let me know in the comments, what muscle group do you find the most challenging to treat or most satisfying to work on?